Okay, I'm going to be talking about the Nahua people of Nicaragua. So, some brief history and topography. Nicaragua is a nation in Central America located midway between Mexico and South America, and it's bordered by Honduras and Costa Rica. The Pacific coast was settled as a Spanish colony in the early 16th century, declared independence from Spain in 1821, then finally became an independent republic in 1838. Nicaragua was first encountered by Europeans when Christopher Columbus explored the eastern coast of America on his fourth voyage in 1502. And then here's Nicaragua on the map. It's going to be hard to see, but it's teeny tiny right here between Mexico and South America. And then this is a bigger map of all the different states or cities in there. So, for their communication, they speak Nahuatl and Spanish. They use lots of symbolic communication, such as like crafts, arts, and textiles. They have lots of rituals and ceremonies that have music, dance, and tell stories. And they have a strong sense of community, such as many group discussions are done within communities. So for family roles, fathers or the eldest males typically serve as the head of the household. Women do play a central role in nurturing and managing the household and taking care of children. Grandparents, aunts, and uncles often live together or nearby, and they help contribute to raising children. Older family members are highly respected and consulted for important decisions. Family is the core of social life, and loyalty is highly valued. Their people of this culture are predominantly Catholic, and education is valued, but economic struggles may cause children to work early and not continue on their education. Some of the high-risk behaviors in Nicaragua is alcohol, teen pregnancy, smoking cannabis and cigarettes, unprotected sex, which leads to STDs, unsafe agriculture practices such as harmful pesticides and not wearing personal protective equipment. There's lots of gender-based violence towards women, and there's also lots of natural disasters such as flooding and landslides. There is no official religion of Nicaragua, but the most popular religions are Protestantism and Catholicism. Another religion, Azteca, is growing in popularity among the indigenous people of Nicaragua and several of the other surrounding countries. La Purisma is held every year between November 28th and December 8th. It is the most popular feast of the year and celebrates the Virgin Mary. That is one of their main holidays. The use of spiritual healers and folk healing are more common than Western healthcare. So now going over some of the diseases and health conditions. Some of the infectious and parasitic diseases include diarrheal diseases, meningitis, tropical cluster diseases, hepatitis C and B, HIV/AIDS, tuberculosis, STDs, and malaria. Some of the nutritional deficiencies include iron, iodine, vitamin A, and protein. Many respiratory infections. Some of the maternal conditions include hemorrhage, hypertensive disorders, sepsis, and obstructive labor. Perinatal conditions include low birth weight, birth asphyxia, and birth trauma. The number one healthcare concern in Nicaragua is dengue. Dengue is an infection caused by mosquito bites, and there is currently an outbreak of this disease. Some of the signs and symptoms include fever, headache, body ache, nausea, and a rash. There's no treatment currently. To help with some of the symptoms, there's NSAIDs for pain, antipyretics for itch, and you can use bug spray to prevent the mosquito bites. In Nicaragua, there is an extremely diverse population. Most Nicaraguans are okay with taking medication. They just have a hard time having access to the medications that are needed. It is important for nurses to communicate with the patients and administer medication that they may need if it is available. They also have to ensure patients aren't taking any kind of herbs or anything that might interfere with these different medications. There's a large gap in healthcare research in Nicaragua, while the country is currently developing further, the needs of the citizens are still not being met in this country. Some of the herbs used here are guava, malva, Christmas blossom, and soursop. And the desired outcome of guava relieved stomach issues and high blood pressure. Malva resolves stomach issues and inflammation. Christmas blossom resolves fever, abortion, and stimulates breast milk. And soursop resolves inflammation and insomnia. Some of the fun facts here: the national flower is sacawan. The jaguar is the official animal of Nicaragua. Even though there are only 7 to 10 active volcanoes, there are a total of 40. And the turquoise-browed motmot is the official national bird of Nicaragua. And then here's some pictures. I know Kathleen was supposed to present with me, and I know she had a bunch of little cool different knickknacks, but her sister has gone on mission trips here before, so she's had plenty of different pictures and little knickknacks to show, but I don't have any of those. And here's all the sources.